Gas formation in the digestive tract is a normal part of the digestion process. However, there are times when excess intestinal gas is caused by underlying primary diseases, as explained below. In most cases, increased intestinal gas is due to the following: 1. Swallowing air by eating too fast, drinking through straws, chewing gum, sucking on candy, talking while chewing, and drinking carbonated drinks or beer, smoking, or wearing loose dentures. 2. Consuming foods and drinks that contain certain types of sugars, starches, and fibers, which are not completely digested by the stomach and small intestine, and which, when passing to the large intestine, are broken down by bacteria, and as a result, gas is formed. 3. Suffering from chronic disorders of digestive system, for example, diverticulitis, irritable bowel syndrome, ulcerative colitis, Crohn's disease, constipation, and gastroesophageal reflux disease. And 4. Suffering from food intolerances, including lactose or fructose intolerance. Symptoms of excess intestinal gas can be a problem if they occur very frequently, bother you, or affect daily activities. Chief among them are belching, flatulence, and bloating. Belching is the release of gas from the stomach through the mouth. People normally burp up to 30 times a day, particularly while taking food or immediately after. Flatulence is intestinal gas that is expelled through the anus. Experts consider it normal to pass gas up to 25 times a day. And finally, bloating, which consists of a feeling of fullness in the abdomen. If the abdomen becomes larger than normal, doctors call it distension. Both swelling and distension can cause discomfort or pain in the abdomen. In the vast majority of the time, the action of belching and eliminating flatulence is normal, natural, and common. However, excessive belching of flatulence accompanied by abdominal bloating, pain, or swelling can interfere with daily activities or cause embarrassment. Treatment to reduce gas formation in the digestive tract includes general measures and natural remedies. The following measures are the basis of treatment to reduce the formation of intestinal gases and, with it, the frequency of belching and flatulence. Here you go, take note. Do not consume carbonated drinks, beer, artificial sweeteners, candy, or gum, and do not smoke or use straws to drink. Try not to drink liquids during meals. Chew food slowly and well. Reduce the consumption of foods that cause flatulence or that, due to their high sulfur content, produce foul-smelling flatulence. The main ones are beans, lentils, broccoli, onions, cabbage, cauliflower, artichoke, asparagus, whole wheat flour, and bran. Walk for at least 10 minutes after eating. Discard tight clothing. Defecate every time the defecation reflex occurs, and arrange, when appropriate, the adjustment of the denture. It should also be mentioned that some people swallow air as a nervous tic, in which case this problem should be discussed with the corresponding professional. In addition to the general measures mentioned above, there are excellent home remedies to reduce gas formation and bloating. The best of them are the following. Ginger tea. The ingredients required to prepare ginger tea are 10 grams of fresh ginger peeled and sliced, a cup of water equivalent to 250 milliliters, and optionally, the use of half a lemon and honey to taste. Boil the water with the ginger for 10 minutes. Turn off the heat, let the preparation rest until it warms up, and strain. Next, if desired, add the lemon juice and the honey. Green tea. To prepare green tea, you need a sachet or a tablespoon of dried green tea, the use of half a lemon, and a cup of water. Bring the water to a boil, and when it reaches its boiling point, remove the container from the heat and let it cool for about 5 minutes. Next, put the green tea in the water and let it infuse for 2 to 3 minutes, no more, as it becomes bitter. Next, it's strained and left to rest until it reaches room temperature. Finally, add the lemon juice, and that's it. Peppermint tea. To prepare mint tea, you need a sachet or a spoonful of dried mint leaves and a cup of water. Boiled water. Once it starts to boil, remove it from the heat and add the mint. Cover the container and let it rest for about 10 minutes. Then strain and it's ready to drink. Whatever the chosen tea, it's recommended to take 1 to 2 cups per day after a meal. These herbal teas aid digestion and quickly reduce gas and the pain it may cause. Finally, apple cider vinegar in water. Apple cider vinegar helps the production of stomach acid and digestive enzymes. It's recommended to add a teaspoon of it in 200 milliliters glass of water and drink it. Then rinse the mouth with plain water to prevent the vinegar from wearing away the tooth enamel. Caution: the formation of intestinal gases and the expulsion of this can be an uncomfortable and embarrassing situation, but it's rarely a health problem. However, it's recommended to see a doctor when excess intestinal gas is accompanied by one or more of the following symptoms: stool with blood, unexplained weight loss, constipation or diarrhea, recurring or persistent nausea or vomiting, persistent or severe abdominal pain, and loss of appetite or feeling full quickly. Well, that's all for now. See you in the next video. Bye bye.